Hello everyone, my name is Rob Brackle and I would like to welcome you all to our Facebook Nursing Live event. Let me start by telling you a little bit about myself. I've been a nurse here at Mayo Clinic for 12 years now. I actually started on a thoracic surgery progressive care unit, and now I work as a nursing placement coordinator. Our topic today is going to be nursing at Mayo Clinic. We are going to touch on what it's like to be a nurse here at Mayo, and then get into what to expect from the application process. The focus today will be on Mayo Clinic in Rochester, but we do have opportunities at our other sites in the regional health systems, Arizona and Florida. The information to apply to those locations will be shared at the end of the event. Joining us for the discussion are two experts in the field. The first is Stephanie Sveen. Stephanie has been a nurse here at Mayo since 1995, working in the inpatient setting until 2010 when she accepted a role within the nursing placement office. And our second guest is Quinn Bissonette. He has been at Mayo for over 20 years and has worked in a variety of roles. He is currently the inpatient nurse manager on a plastics general surgery unit. It's going to be a great discussion, so please send in your questions under the Facebook Live video feed, and we will try our best to review them during the live broadcast today. Thank you guys for joining me.
Thanks, Rob.
It's going to be a good time. So Quinn, let's start with you. Can you talk to us a little bit about nursing at Mayo Clinic, or what's it like to be a nurse here at Mayo Clinic?
Absolutely. So as you alluded, Rob, I've been here 20 years, and I think one of the primary things that differentiate nursing at Mayo Clinic is the legitimate commitment to the primary value where the needs of the patient come first. And nurses have a strong supporting cast that support them here to position them to be successful not only personally, but professionally. And as a nurse manager, that's one of the most important things that I do, is be in service to those who are in service to others. The teamwork is unprecedented, and there is collaboration with the practice and administrative arm. So we have this full scope working towards this common vision and this primary value where the needs of the patient come first, and ultimately it affords a phenomenal human experience.
Great. You know, and one of the things that we get asked a lot about, because I think people have heard of Mayo Clinic, but one thing they don't understand or grasp sometimes is how big this place is. So, Steph, can you tell us a little bit about the campus here in Rochester?
Sure. Mayo Clinic Rochester was the original Mayo Clinic location. We are a pretty large campus. We actually have two hospitals on our campus. One at St. Mary's, which was where the original Mayo Clinic started, and the other is in what we call our downtown campus, which is Rochester Methodist Hospital campus. Those two hospitals have more than 1,000 beds, so we have patients with many different specialties. We have inpatient opportunities, ambulatory opportunities, as well as procedural and clinic type areas. Great opportunities for nurses from the time they graduate all the way through retirement. Mayo Clinic has been open-armed for new grads from its very beginnings. We love new grads. We work with new grads continuously.
And speaking with new grads here, so with a size that big, how do you feel Mayo Clinic does, or how does Mayo Clinic support new grads or new hires coming in?
So as I mentioned, we've welcomed new grads always, since the beginning of Mayo. And I think the best way that we can support new grads is to give them a solid foundation. And we do that through a very robust clinical orientation. So we welcome them to the patient care units. They are always working alongside trained preceptors, nurses who are at or near the expert stage of their career. We provide them with educational opportunities, and we give them a very robust exposure to what their role will be, so that at the point when they're ready to practice independently, they are comfortable, competent, and confident. In addition to orientation, all new grads hired at Mayo will also be part of a nurse residency program. And the nurse residency program, as I said, is offered all year long to every new grad that's hired at Mayo. Quinn, do you want to talk a little bit about the benefits of the nurse residency program?
Yeah, so the residency program just further prepares new grads for the unit. It puts them up from taking really from the didactic kind of conceptual model into the experiential piece, where they're actually living it and contributing to the floor. I think a big part of when new grads come, it's creating that sense of community, and that's that purposeful connection established not just from leadership, but authentically from other people in that care area. And it goes back to how I started this conversation. It's that investment in the staff, so that they know that we are here for them. They are part of Mayo Clinic.
Right.
And I think when I'm talking to new grads a lot about the nurse residency program, there's a lot of benefits to the program, but there's two of them that really stand out for me, and it's one that we've touched on, is support. And then networking, because when you're in the residency program, it's going to start probably at about month 2. But when you're going through that, you're going to be in groups of probably 30 to 40 other new grads, all starting at the same time, and you're all going through very similar types of orientation. So you have each other to lean on during that time, but the best part is you can network with 30 to 40 other new grads that we've hired from all across the country. So you can not only do that, but see the diversity that we've hired as well. And the level of support, another thing that I like to talk about, kind of piggybacking off what Steph said, is that's one thing that I actually loved most as a new grad coming here, because I'm not originally from here. So I actually came from Nebraska, and one of my biggest things was, am I ready? You know, is this a place that I'm going to be successful? And I thought, I don't know, is this really what I'm going to be able to do? And when I got here, I quickly realized that I was going to be ready because of the level of support that I got. The trust in the orientation process, the support from not only my preceptors, because I had probably 2 or 3, but you get a level of support from everybody on the floor, all the nurses. It kind of feels like you get hired into a family, so to say. And to have that level of support as a new grad was phenomenal.
Yeah.
So Quinn, what are some of the growth and development opportunities for nurses here at Mayo Clinic?
Oh, they're really unlimited. And whether it's precepting on the unit to becoming a charge nurse or becoming a clinical coach or participating in many of the unit committees or even departmental committees or even enterprise opportunities. And even independent of that, you can look at the specialties because we are so specialized. You can be a flight nurse, you can work in colorectal surgery, you can be a patient care assistant, you can work in the NICU. I mean, literally, the opportunities are endless. And now as we transition into seeking to cure, connect, and transform the healthcare industry and look for ways to disrupt it from within, we'll begin to leverage technology more and more and more. And again, nursing informaticists and other opportunities shall evolve. Myself, I started as a patient care assistant on a colorectal surgery floor and lived in that role for about a year. And then I transitioned to general care as a registered nurse and was there for about 12 years. Loved it. Became the clinical coach, the preceptor, the charge, did some of the things I've named. And then it was in that moment that I had that kind of eureka, the light bulb went off, where I was inspired that I have something else to offer. And it took the investment, again, that we keep talking about, the support from this, the staff and leadership to say, there's something else out there for you, Quinn. I became a hospital health supervisor, had responsibilities at both hospitals, Methodist and St. Mary's, and then became an ambulatory nurse manager. So I thought I knew it all after doing all that for 14 years, right? And then again, the ambulatory world, and I'm like, wow, whole nother animal. And for the past several years, I've been inpatient nurse manager role. So again, the opportunities, really, it's endless. It's phenomenal.
I think the key is, and I tell people this a lot, is to get involved and to do as much as you possibly can. And that's another thing that I love so much about being here at Mayo Clinic, is that we want to see you grow and develop as a nurse. And the things such as being a preceptor and a charge nurse and being involved in committee work, that'll come. It's probably going to come, I would say, if you agree with me, probably at year 1 or 2, because it takes a good year before you kind of step into those roles. But the benefits are, absolutely huge, because first you're going to become that mentor, that go-to person, and build your leadership skills up on the floor. But long term, for those who are thinking about going back to school, it'll help guide you into which path you're going to take. So when I came here 12 years ago, I thought I was going to do something completely different than what I'm doing right now. And it took those opportunities on the floor for me to see there's another side, there's something else that I kind of want to do. And that's what led me to more of this leadership type position. So I always tell people, take advantage of every opportunity that comes your way when you're here.
Right, and enjoy the journey.
Yeah.
Because that's the one thing we like to say, is that the sky's the limit for nurses. So often new grads come to us with this pre-planned goal set. They know exactly what they're going to be and exactly how they're going to get there. And what Mayo is really good at is tapping you on the shoulder to say, hey, I think you'd be really good at this. And I came to Mayo, full disclosure, I was going to be a nurse midwife. My goal in nursing school was I was going to deliver babies, and I have never worked a single day in OB. And I don't regret a second of my career. Mayo tapped me on the shoulder. My supervisor, my nurse manager, gave me the opportunity to do things that I never dreamt I would do. And I have enjoyed every second of my career at Mayo. One thing that you touched on that I just wanted to add is supporting you through those transitions. Once you've been here for a year at Mayo, they have this program called PDAP, Professional Development Assistance Program. And if a nurse does decide to go back to school, Mayo will financially support them through tuition reimbursement, which was exactly
Right.
one of the opportunities that I know both you and I
Yep.
have, and you as
Yep.
well. We've all used PDAP to advance our careers at Mayo. So you can do anything you want as a nurse at Mayo.
Great benefits. So let's just say I'm a nursing student. So what are some of the things that maybe I can do to help prepare myself for being a nurse in general and then here at Mayo Clinic?
Well, a lot of what we touched about here is culture, right? So it's this moral ecology where there's this continuous reinvestment in the staff and this perpetual growth that creates this phenomenal culture in this environment. So in order to create that and sustain it, we need diversity, right? And we need people that represent that same moral ecological compass. So when I'm looking for new staff, when I'm interviewing somebody, we're going to ask the interview questions, and there's going to be all these source credibility things, which is everything you've done on paper, right? It's your resume. It's kind of like your ticket in, right? But then I'm going to want to hear about everything you did that shows to me that character, that common good, that trust, those things that will transcend any work environment, the character component.
And then as far as getting involved, we talked to a lot of nursing students going through their sophomore, junior, and senior years. What are some things that they can do that are going to help guide them and figure out where they're going to work, especially specialty-wise and things like that stuff?
Right. I think as a nursing student, whether you're a freshman, sophomore, junior, senior, if you know that nursing is your end goal, I would say the best thing you can do is to get involved with direct patient care, whether that be working as a CNA or, seeking opportunities like externships during the summer, internships, maximizing your clinical exposure, getting involved with direct patient care. The more of that you do, the more comfortable you'll be in that patient care setting.
Absolutely. And speaking of that, we want to get to one of the viewer questions that we have here regarding externships. They want to know, does Mayo Clinic have an externship?
We absolutely do. We have an externship during the summer months. It's called the Summer 3 program. It's actually been around at Mayo for more than 50 years. And so that just is a testament to our welcoming culture to new grads. We bring student nurses in to spend the summer with us for 10 weeks during the summer prior to graduation. The application for the Summer 3 program actually went live on October 15th, and it will stay online until January 15th. We typically select around 50 to 55 students to spend the summer with us. It is a paid externship, and we do also provide access to housing, which is pretty neat. The students are actually immersed in the city of Rochester culture, which is great because they get to feel what it's like to be part of the Rochester community. And then they are working alongside preceptors. So they're working alongside Mayo nurses during every shift throughout the summer. They get to see it, they get to feel it, and they get exposed to some of the most awesome, patient care providers in the world, in my opinion.
Sure. So the application for that is live right now, so
Right.
you can go out and apply to that. So when the applications come in, is there a deadline? When does that come down, and how soon do people find out if they got accepted into the program?
So the deadline for application is January 15th. And we will begin screening all of those applications immediately following January 15th. We have this soft goal set that we will have offers out when we shoot for Valentine's Day. Now, that's a soft goal, but we like to meet our goals here at Mayo. So most people can expect to hear back from us by Valentine's Day.
Happy Valentine's, right?
Yeah.
That's right.
It's just a little extra treat, right?
Summer 3 program is outstanding. It's awesome. You get this new, diverse input from these folks that are in their junior year, and they bring this energy. It's outstanding. I encourage everybody to capitalize on it. From all over the states, folks.
Yep. And speaking of the application process, I want to transition into that because that's another topic of discussion here. And so let's talk a little bit about what applicants can expect during this time. So what are some of the things that you're both looking for in an applicant and or a resume?
Sure. So from my standpoint, we look at the applications first before sending them on to the nurse managers for review. So when I'm looking at an application, I want to see a robust resume. Sometimes in school, when you're in nursing school, they tell you have to have a one-page resume. I want to throw that concept out the window unless you're doing an assignment for school. And if they tell you 1 page, then stick to 1 page. When you're applying at Mayo, we're absolutely okay with 2 pages. If it needs to be 3 pages, that's great as well. I want to be able to look at that resume and see who you are, what you have done. If you were a lifeguard, if you were a nanny, if you're applying to a pediatric area, I want to see that you were a Sunday school teacher or that you worked at SAC taking care of school-aged children. I want to see those things, even if you don't think it's important to the nursing career. It shows character. It shows what you've been involved with. I would say the most important thing I want to see on a resume are your clinicals. I want to see where you did clinicals, what hospital you were in, what patient specialty you were taking care of, and how many hours you spent in each of those areas. And at the top of that clinical section, I want to see capstones, immersions, senior preceptorships. Those are the things that I want to see in a resume.
So I know that Steph's going to screen through the resume, and she's gonna send me up someone that meets all of her expectations. And then when they get to me up on the floor, I'm going to take a look at the cover letter, and then we're going to have a conversation.
Right.
And this is where we're going to really start to figure out the character. Who is this person? Who is Rob Brackle, the candidate? Here's everything he's done, making him eligible for the position. Phenomenal experience. Clearly you're prepared. That's why Steph sent you to me. Now tell me, why specifically do you want to work on this floor, and what do you intend to bring? What are your dreams? What are your goals?
And that's exactly what a cover letter should be. Your cover letter should tell the story of your resume. It should talk about, here's the bigger strengths that you have, and oftentimes it may be that capstone or that preceptorship, but definitely the desire that you have to work on that unit. So we definitely want to see cover letters on top of the resume. But when you start adding up all the clinicals and the work experience and volunteer experiences that we ask for, you'll probably have about a 2-page resume, and that's not uncommon, so that's good. I have another viewer question I want to get to, and this is for when can I apply? In particular, December grads for the question here, and then May grads.
So December grads can begin applying now. Typically right around that October 1st time frame is when we start to actively look and consider December graduates. For those new grads that are graduating in the spring or May specifically, May graduates should start applying right around that February 1st time frame. These are not set in stone, of course, but we really actively start considering May grads in February, December grads in October. And new grads can apply to as many positions as they want. That's one thing that sometimes people ask us about. How many positions can I apply to? We don't typically recommend that you apply to 50 positions. Keep it narrow. We want to be able to look at your application history and kind of decide, where does this person really want to be? Because we want you to be where you want to be. It needs to be a good fit.
Absolutely. So are there any areas that we don't consider new grads?
Yes, actually there's a couple. We do not consider new grads in the ED, so in our emergency department or ER. That is a place where you need to have some experience. So we don't actively consider new grads in that area. And we also don't consider new grads in our family birth center. Again, that's an area that is highly competitive, and we typically fill those positions with experienced nurses. If they're applying to areas such as an ICU, we've got to see ICU clinicals on that resume. We need to know that you're ready for an environment like that. So those are some things that really we need to see in those applications.
Okay. Another question that we have, it's not one that we like to talk about,
Yeah.
but the question does come up, is boards. What if I fail boards? What would happen?
So it is very possible for a student to apply to a position today, interview next week, and accept an offer within a week from that point. So you may have your career ready to roll before you ever graduate. And then there's this piece of NCLEX, because in the state of Minnesota, you have to have an RN license before you can start your first day of employment as a registered nurse. We do take into consideration that time frame that will allow you to take boards. So for those December graduates, you can expect to probably start working around February. For May graduates, it's usually the middle of July or the beginning of August. So we set that start date at the time of the offer. So what if NCLEX doesn't go well? Well,
If you've already come to me and we've interviewed, and I think you're phenomenal and I've offered the position, I want to be a part of your dream.
right.
And this is your dream. We're going to get there together. go take the test again.
Take the test again. Most often, we will allow a second test, and according to NCLEX guidelines, you have to wait 45 days before you would test again. So typically, what I would do when a new hire reaches out to me and says, "Hey, Steph, I didn't pass," I'll probably call the nurse manager, Quinn, and I'll say, "Quinn, Rob didn't pass NCLEX, so what are we going to do?" And then we just look at our start dates, and we renegotiate a new start date. There are some areas where we just can't wait for new hires. So in some ICUs, if necessary, we may go back to the drawing board, but that doesn't mean we don't want you at Mayo.
Right.
That means we want you to focus on passing that test and then reach out to us when you're ready to go.
Right.
NCLEX is not the only factor in whether or not you're going to be successful as an RN.
Right.
And I know, Steph, you talked about hiring. Typically what we see for December grads, they may start late January, February. May grads, July, August. But reality is we do actually hire all throughout the year. We have start dates each month, actually. And anytime that you're hired, you're automatically going to be enrolled in that residency program. But you can start at any time. It's just those are the two high times, especially when it comes to the December grads and the May grads.
Right.
So let's play this out as if, what happens when I get selected for an interview? What does that process look like? Especially maybe I'm from well out of state. If I'm selected, can I do a webcam interview, or do I have to come here in person, or what do you think?
We do webcam interviews almost every day. A lot of the applicants that we do get are from across the nation, and so it's not uncommon for us to interview via webcam. Typically, a new grad will interview first with the placement coordinator, and then immediately following that, they'll interview with the nurse manager. Our nurse managers are used to interviewing via webcam. We use technology to our advantage in this situation. Obviously, in the perfect world, we'd be sitting across the table from each other, but that's not always possible. So webcams are absolutely okay.
And then it's a two-part process, like you said. In the nursing placement interview, we always tell people we like to get to know them. It's our job to figure out, are you the right fit for Mayo Clinic? They go to that nurse manager. The nurse manager's going to see, are you going to be the right fit for the floor? But you will have typically a two-part interview with that. Another question that we had was actually going back a little bit to the job postings and then when they're hired. What shifts do you see typically that new grads typically tend to work? As far as what should they be looking for in a job posting?
Right. So our advice is always to look at every detail of a job posting, because within the job posting you will see, is this a day shift, day evening position, or a day night position? Is it 8-hour shifts? Is it 12-hour shifts? I would say that most new grads are looking for those straight 12-hour shifts. And I would say that almost any inpatient unit has the opportunity to work into 12-hour shifts. You may not get 12s from the get-go, but 12s are available in almost all inpatient units.
And I think that's okay that you may not get 12s right out of the gate. Right? Practice makes better. We go back to the NCLEX. Not passing NCLEX alone doesn't necessitate ineffective nursing. It's just part of the process to get there. And maybe you don't get 12-hour shifts right out of the gate, but just by sheer exposure alone, the 8-hour shifts, you gain more experience, you gain more practice.
Yeah, 8-hour shifts I think are ideal actually for new grads. Research tells us that you learn best in shorter periods of time.
Yep.
So in a
Get more
12-hour
practice.
shift, your brain becomes a little bit saturated by the end of that shift. So 8-hour shifts are a good start. 12s are something that I think you should work into. Don't select a job based on the schedule.
Right.
Select a job based on your passion for that patient specialty. Most all inpatient positions here at Mayo will either be a day evening or a day night rotation. We don't have straight day positions in the inpatient setting. If you're looking for straight days, you want to be looking at the ambulatory or the procedural areas. Some surgical services as well do offer straight days, but in the inpatient setting, it's going to be day evening or day night with a weekend rotation as well.
Can new grads get hired? Obviously, we talked about the inpatient side a lot, but can they be hired into the ambulatory side as well?
Absolutely. There's several areas that will welcome new grads as well. Ambulatory, some people think that ambulatory is, it's definitely different. It is not as high acuity. Patients walk in and walk out at the end of the day. But one thing about ambulatory is the pace. And you have a finite amount of time to accomplish what you're going to accomplish with your patients. And so you've got to have very sharp assessment skills. You've got to know your resources inside and out. So I would say we do hire new grads into the ambulatory setting. We welcome them, actually. Ambulatory is where healthcare is moving. You know, we're going to see a lot more patients care in the ambulatory setting versus the hospital setting in the future. So absolutely, we will consider new grads in that setting.
Great, thanks. Well, guys, that's all the time that we have for the interview, but we would like to take some time to answer some more questions, some more viewer questions as they come in. So let's see if we have some that popped up. So one of the first ones we have is, do you hire CNAs, and is there a tuition incentive to get an RN as well?
We absolutely hire CNAs. In the hospital setting, we call them PCAs, patient care assistants. Speaking from my inpatient experience, I couldn't have done my job without strong PCAs next to me.
I was a PCA.
Yes, it's a good start. It's a great start. We don't necessarily offer, it's not really an incentive to get your RN. We don't expect our PCAs to go back to school to become RNs. If you choose to do so, definitely take advantage of that PDAP, that tuition reimbursement program. We have some strong nursing programs here in the Rochester area.
Great. Another question that we have is regarding internship. So if I got an internship, or even probably their capstone or immersion, that might be what they're referring to, in the NICU, does that count as clinical time for them to be competitive to get a secure position within the NICU?
In the neonatal ICU, yes. That is, it's probably, you're going to have an experience in the neonatal ICU to be considered as a new grad in that environment. It's one of the ICU environments that we really need to know that you've been there. We really need to know that you've experienced it. And without a clinical capstone or a robust clinical exposure to the NICU, it's going to be a tough one.
And I think the PICU would be the same thing, the pediatric
Absolutely.
ICU as well, correct?
Absolutely.
So the other question that we have that could be coming in is, how easy is it that you transfer? I know we get a lot of people that maybe start here and then they ask questions about, can they go to different units from time to time? How easy is it for them to transfer within Mayo Clinic?
Very easy. Again, that speaks to the volume of the opportunities. There's, we expect that you stay with us for a period of time, and I think that's very important that you do, because as I alluded, practice makes better. For those that are new grad, it's going to take about a year just to get your feet wet, kind of to figure out some of the time management, some of the flow. But then after that, we're going to have a conversation. I'm going to say, okay, what's the plan? What's the plan for Rob? What's the dream? What's the goal? And let's start building a plan. Take small sequential steps over time to help you achieve that. And very likely, that might be going to a different area. And absolutely, we support that. If it isn't, then let's find out how we facilitate that dream here in this environment. But very mobile.
Mayo Clinic expects a 1-year commitment to any position that you take. In some areas, they will ask you for a 2-year commitment, and that's because the greater part of your first year is going to be spent learning. That second year is when you really start to create your own practice, and it's really when you start to find yourself. So don't be surprised if they sometimes will ask for a 2-year commitment.
Yeah, another question we got is regarding another immersion experience. So if they are, I think sometimes we have December grads that their immersion's actually going to start in January. Do you still recommend applying or waiting until February? Or I'm guessing some of these guys, they might graduate or come close to graduating in December, but they have a final immersion to wrap up with in January. When should they start to apply?
I would say what we usually say is about 3 months prior to graduation. And so again, it's not set in stone, but if graduation is going to take place in January, or the completion of your program takes place in January, you want to start applying about 3 months prior to that.
Okay. Another one we have is, we have a graduate of May of 2020, and they're interested in the emergency department. Are there any other units that they can work? We just said that we can't hire new grads within the ED. Are there any other areas that might benefit them, and then maybe in the future get to that point, potentially in the ED?
Sure. I think any inpatient environment will prepare you for the ED. I would choose an area where you're going to get a high variety. The higher acuity, the better, but not necessarily. I think the preference for an ED applicant is someone who's been either in a PCU or an ICU, but I can tell you, we take those general care nurses as well, because the experience that you get there is so invaluable. So I don't think there's a wrong place to start. if you want to end up in trauma.
I think the value there is the continuum.
Yes.
So if you apply and get a job on a general care floor, whether it be orthopedic surgery or whether it be medical GI, it doesn't matter, because either one of those patients likely came in via the ED.
Right.
So that you can speak to that continuum piece, and what you build within that first year, that time management, all that practice is what will translate back down to the emergency department.
Great. Another question regards, so for experienced nurses, can you discuss how the application process looks different for them maybe compared to new graduates, or is there much of a difference for them?
I would say that for an experienced nurse, obviously when I'm looking at an applicant pool, I'm looking for the nurse or the applicant that is the best match for that position. Nurses that apply with experience, they're going to be strong applicants.
Very strong.
And so obviously we like to see that. So definitely experienced nurses should apply. We will give you information at the end of our broadcast today to talk a little bit more about how you could reach out to one of us to talk about opportunities for experienced nurses as well as new grads.
Okay. And then one of the last questions we have, does Mayo Clinic offer relocation assistance for new graduates coming here?
Yes. That's a great benefit, actually. There is relocation assistance for any nurse that is hired at Mayo. I believe it's 70 miles. If you live more than 70 miles from our campus, you will receive a relocation reimbursement package. It's not money that you're paid up front. It's money that is paid back to you after you've started working here. It's based on mileage, so how far away from our campus you live is how we determine what that benefit looks like, and that those benefits are always discussed with HR at the time of an offer. So definitely we want to help you get here.
Great. Thanks, guys. Thank you very much. That's all the time that we have. So in closing, we want to congratulate you on choosing an amazing profession. You will never regret your decision to become a nurse. And many of you will have questions that come up following our live event. And please feel free to continue to submit those questions on this Facebook site, and we will do our best to respond within 24 hours. And if you prefer to reach out to us directly, you can email us at the address you see on the screen. If your questions are regarding Mayo Clinic sites in Arizona, Florida, or the health system, we will be sure to route you to the appropriate contact person. And also feel free to follow us on social media through Instagram, Facebook, LinkedIn, Twitter, and YouTube for upcoming nursing events. Thank you, Stephanie. Thank you, Quinn, for joining us. And thanks to all of you for joining us today. And good luck in your future career.